More medications, less health. Something's broken. Traditional medicine manages symptoms, but true healing addresses root cause. I'm Josh Rimini, pharmacist turned healer. At Beyond the Pills, we merge ancient wisdom with modern day science to inspire you through stories of transformation, practical trainings, and holistic healing. Join me and other practitioners as we guide you towards vibrant health, body, mind, and spirit, and move beyond symptom management into true healing. Hello, everybody. Welcome back to this episode of Beyond the Pills. I am Josh Rimini, pharmacist turned healer. And today we're diving into the conversation that hits at the core of modern men's health: metabolism, performance, longevity. Our guest today, Dr. Suren Naidoo, he is been doing this for a little while. Our guest, he's been doing men's health, metabolic performance, and longevity in a specialist, focused on helping men between ages 40 and 70 reverse metabolic decline, type 2 diabetes, and insulin resistance, while restoring things like testosterone. We've talked on that subject, and I'm looking forward to that, and reducing cardiovascular risk and reclaiming long-term vitality. He's the co-founder of Vital-Health.ai and digital platform helping individuals monitor key health metrics in real time, and the founder of Man Strong 2, where he empowers men using his proven 5R method to reverse chronic disease and prevent heart attacks. His mission is powerful and timely: to help men understand that being unwell is not a weakness, and that real strength comes from taking ownership of your health. If you're a high-performing man, entrepreneur, or leader who's been putting your health on the back burner, this episode is for you. Welcome to the show, Suren.
Thank you, Josh. Thank you for inviting me to your Beyond the Pills podcast. I'm really looking forward to having a lovely chat today, and thank you for the lovely introduction. So I'm all yours.
No, I love it. You got into my stream in my field of awareness as I'm talking more and more about men's health and vitality, and so I love the synergy. I love, because what we're doing here is so powerful, not because we're just looking to help men get more testosterone or do the old way. And I want to have those conversations. But let's start here. Let's learn a little bit about you and how you got to where you are. Take us back. Where was the moment where you realized the traditional approach to men's health wasn't working?
Well, Josh, let me take you back a little while.
Let's do that.
Well, I was born in South Africa, in Durban, many, many years ago. You can see all my gray hairs now. So I left in the 60s during the apartheid years, and we came to London to study to improve my education, and I eventually went into university, the Royal College of Surgeons in Ireland, qualified as a doctor. And my interest started when I started my internship, because the consultant I worked for was a diabetic specialist. And really, I then became interested in endocrinology and diabetes. And that's what really triggered me in terms of deciding, well, there's something more to just treating patients with diabetes. Because diabetes is such a chronic inflammatory process. It affects all your blood vessels in the body. And as I continued my studies throughout the years and did my different levels in medicine, and then went into general practice, and then I became the diabetic and cardiac lead in my practice. And when I was in NHS GP work, that's all I did mainly. It was diabetic patients, cardiovascular disease, and I saw a lot of men coming in at late stages when they had symptoms of erectile dysfunction, and they wouldn't even talk about it. but then they would have symptoms of chest pain leading on to heart attacks. And when I'd finished my NHS practice, and I had time on my hands now to set up my private practice, and I decided there's something a lot more to something to diabetes than and cardiovascular disease and erectile dysfunction. And I put this triad together, this trio of symptoms, because end of the day, a lot of men who will have erectile dysfunction won't talk about it. They won't discuss it with their partners. They won't discuss it even with their friends. They just become too embarrassed to discuss it. So I then decided, let's look at this thing in a more logical fashion and look at how diabetes causes these problems. How can we reverse these problems before it gets too severe? Because a lot of them will also have silent heart attacks. And that's how I really became interested in the whole idea of treating and forming my program.
I love it. And when we initially talked before the episode recording here, it was a fun conversation because you were linking, it's the whole adage of like, why does someone come to see a physician, right?
Mhm.
And they don't come because they have diabetes per se.
Yeah.
Sometimes it may be at the end, but like they're coming because they have some erectile dysfunction, which is functioning their sexual health. Like they're it's hard to talk about, but you were kind of linking, well, they're coming in for this, but where's the why, right? If you're looking at endothelial dysfunction and
That's
nitric
right.
oxide dysfunction and all these things that are caused from metabolic
Yes.
problems that have that downstream effect. And I don't think a lot of men's clinics are thinking about that in the way that you did. So I love that you had that kind of thought process from that beginning.
Because it's so important. I mean, your endothelium, which is lining your blood vessels, is a fine layer of cells. It's like tissue paper. And that's being destroyed every time you eating your food, for example. If you're eating the wrong types of food, this will cause damage to your endothelium. And you get formation of plaques and cholesterol plaques built up and eventually leads to heart attacks. You don't get that. So what you want to do is to improve that release of the nitric oxide, because it's that nitric oxide which allows your vessels to become elastic and remain elastic so they can stretch and get that increased blood flow. So that's the aim of nitric oxide, and having a good diet, walking, exercise, all these things play a huge advantage for the male patient, because a lot of them, these executive men, are so busy working, they just don't have the time. And they don't think, well, I don't, they may think they don't have the time, but if it's once they get into the program, then they realize they can have the time. Is you need to make time to do these things.
I have that conversation a lot with clients. Is one of the number one objections to all things in health or whatever thing is I don't have enough time, and I try to reframe it when I can, because the reality is we all have the same
The whole
amount
lifetime.
of time. We have all the time we need if we're prioritizing, right? But you said like that's why one of my people, clients that I love to work with are the high performing executive people, because it's not that, but there's a fine line between high performing and burnout,
Yes.
and then the downstream effects as you and I work on, which is health, right? Their health and well being. And so you said something pretty powerful that I think is really important, which is when someone has a symptom of something like, I don't know, erectile dysfunction, because that's a big one for men. That's what gets them in the door. We're already, we've already identified the dysfunction of that, which is the endothelial dysfunction, which is the nitric oxide dysfunction, which is somewhat linked to, or what can be linked to, the metabolic function. So it's nice to get them in the arena for, hey, if you need this, we got to work here too. Because do you talk a lot in the beginning with your clients? Because, I think a lot of people are still stuck on, well, I need the pill for that. I need the pill for the erectile dysfunction, which is literally helping nitric oxide pathways anyway, but cause more than effect, right?
Absolutely. Absolutely. You see, a lot of men don't realize it's not just taking the blue pill. That's not the answer. The answer is what's causing the problem. What's the underlying effect of taking a pill, and what's and having side effects than not taking a pill and looking at the actual cause. Because once you get ED, 2 years down the line, you're likely to get a heart attack. And men don't realize this. They feel, well, ED is a problem. It's just a part of normal aging. I'm too embarrassed to talk to my wife. I'm too embarrassed to go to the doctor. What will they think of me? I'm losing that macho image of a man. And that's not the case. It's not a weakness. Men should be braver because at admitting to a problem is not a weakness. And going and seeing your GP or seeing your doctor or your ED specialist and actually finding the right person is also important, because you just don't want to go and have treatment for ED. You want to look at your holistic approach to actually having some treatment and looking at the cause, looking at your nutrition, looking at exercise, because walking is a powerful, powerful way of improving your vasculature, improving your blood flow, improving your brain, improving your reversing diabetes. And all you need is 30 minutes a day. And this makes a huge difference in terms of your health.
Well, I'm very happy that there are providers in the world that are starting with that thing, because what I'm seeing and why I've really focused myself as well in men's vitality is, we'll talk about the testosterone piece because everyone wants to hear that in different ways. But that other side, that you're linking a cause and an effect, because if someone does have ED, that is a sure sign of endothelial dysfunction rather than an ED. And I'm glad that we're bringing this to people's thought and awareness, is because the men out there listening, or the spouses or the partners who have men listening, is if there is that dysfunction, I don't think we're doing service to these men if we're just treating the symptom and of the dysfunction, right?
Right.
And a lot of men seek, hey, the end result is if I can get this worked out, then I'll be okay. Resolve the things that you were talking about, like exercise, nitric oxide support, nutrition, then we're doing them a disservice, right?
Absolutely. I mean, it's like putting on a sticking plaster. We're just papering over the cracks. So what we really want to look at, these men coming in with ED, we just don't give them a blue pill and say, right, go away and take this pill, and your symptoms will improve. What we really want to look at, the underlying cause, what's the reasoning behind this problem, and how we can prevent them. Because no point having ED and you end up with a stroke. No point having ED and suddenly you got a heart attack, because you want to prevent these sort of symptoms happening in the first place, and then you can enjoy life better, because you don't want to be living longer and you don't want to be lying in bed with a stroke. You want to be living longer, but you need to have a healthier health span and a healthier lifespan so you can enjoy your sex. There's no point me saying, yes, take this pill and go away and you'll be fine. You're not fine. You'll be missing the important cardiovascular risk factors: blood pressure, the risk of a stroke. Measuring your blood pressure is so important. Looking at your exercise, looking at your nutrition. And then we can come to other things like hormones and testosterone, etc.
Yeah, I think it's so. I know I've been speaking on this subject for a long time, but it's really nice to just pause in this episode to really grasp the truth behind the words, right? And this is why I love having these conversations, because
Yes.
it's, instead of just getting your problem fixed, like we can get people feeling better quickly. That's not a problem. It's not difficult to do that.
Yeah.
But what you said was really important is like if you're having these conversations as a clinician, as someone in the provider space, directly talking to someone that says, we're not going to just fix you with the
Mm.
problem. We need to address these things because of the cardiovascular and the metabolic components to
Absolutely.
health. Because truthfully, if we're all looking at this from that lens, is everybody wants to live better. They just don't want to live longer, right? Like you said, longevity to me is too much of a buzzword because
Yes.
I want to live as vibrant as possible
Mhm.
until I'm almost at the edge of this
Yes.
existence
Yes.
and we just want to fall off, right?
Absolutely.
Well, right, because you
Absolutely.
said, "Let's enjoy life. Let's just
Yes.
not like let." So I think we're getting to that place where people can start to realize, especially when you're in that 40s and 50s and you've kind of lived that first mountain of life of
Yeah.
success and everything on the outside, it's natural for men and for women to start like turning inward and thinking about those things, and
Mm.
you're catching them at that space because this is the time where biology sort of takes hold of some of these lifestyle choices or environmental factors.
Yes.
You've talked about that as well. So let's talk a little bit about your methodology around that, your 5R method. So let's walk us through a little bit of that.
Well, the 5R method stands for 5R stands for one is reset. We're resetting your body, and that we'll come back to each one in turn. Then the second R is reigniting your energy, and then rebuilding your strength, reclaiming your health, and finally rising into the man you want to be. So that's the 5R method. So at each one, at each step, first of all, in resetting your body, that's where it's the baseline. We do a series of blood tests to measure your baseline in terms of full blood count, your HbA1c, your cholesterol profile, your testosterone levels, your PSA levels, and importantly, more importantly, looking at your special blood tests like your gut health. We measure gut health because gut health is really important, as in terms of the microbiomes and gut health, which can cause inflammation and cause effects on your heart
Yep.
and brain. So we take blood tests for that. We also do some genetic and epigenetic studies to look at how we can improve or predict heart disease in the future. And these are done by saliva tests. So that's basically the resetting. We need to know where you are. Once we have all those tests go on, then we start to reignite your energy. And not just with pills, but with giving you coaching in terms of looking at your baseline, in terms of your blood pressure. Because when you go into the doctors and you get your blood pressure measured, and you'll get a figure, say 120 or 140 over 80. But people don't talk about the third figure, which is the pulse pressure. But the pulse pressure is the arithmetic difference between your systolic and your diastolic pressure. And the pulse pressure gives you is an important predictor for elasticity of your vessels. So if you get stiffening of your vessels, this pulse pressure will widen. So you want a pulse pressure as low as possible. So the range could be anywhere between 40 to 60. So you want your pulse pressure to be much lower. And another thing is important thing is the pulse rate. So is it regular or is it irregular? Because a lot of people will measure the blood pressure, but don't actually feel the pulse. They just look at the pulse on a blood pressure monitor, but they don't know if it's a regular pulse or it's an irregular pulse, because it's the irregularity and irregular pulse, what we call atrial fibrillation, which gives these people strokes. And people don't realize this. So how important it is to actually measure the pulse. So that's part of the reigniting yourself. So we look at that, and then we go on to other coaching on with the patient, and we're rebuilding the strength with nutrition, with exercise, because walking has so many benefits. Walking 30 minutes a day, you don't need a gym. Walking is free. There's no side effects.
Yep.
There's no side effects. You don't need special pills to bring down your blood pressure or your cholesterol. People may have multiple things, but walking in the end of the day is an exercise which actually is a medicine. It's in itself. So all it walking even after meals reduces your cortisol, reduces your blood pressure, reduces your cholesterol levels. It brings down the bad cholesterol, the LDLs. So it has so many advantages. And then finally, we go on to look at hormonal symptoms, like hormonal products like testosterone, for example, and to see if there's any deficiency in testosterone, because testosterone does play a part in
Yeah.
terms of men's health. And because although as we age, our normal testosterone levels will start to fall. But in diabetic patients, the testosterone levels are even lower. And we don't measure this testosterone. This testosterone is important for muscle health and muscle mass. Because if you've got good muscle mass, you absorb your sugar from your blood into your muscle. And this helps reduce your diabetes. And then finally, we go into the final part, which is the rise part, which is where patients can rise into the men they want to be. By that, we give them extra coaching. We help them repeat the blood test at the end and show them the difference, how they were when they started, and 6 months later, how they've improved.
I love that.
That's just in a nutshell, a quick
No, no, it's nice to hear because I think a lot of times you've explained it in a really nice way and with ours so people can remember it. And it's a nice place to have people realize like your health is a journey. It's not a destination. And some people need, and each one of these it's not like a phase, it's just part of the process, right? And I love the rising up, right? The piece where I think I've seen a lot of like, I don't want to call them failures, but maybe challenges is people go through protocols, right? They go through the body stuff and they get all that worked out. Like you can reset, you do the gut health, you do these things, but then that piece that ties it all in, right? At the end, there is kind of like you're building that initiation for somebody to really ignite their purpose, get them like men want to be impactful. We
Yes.
want to be able to do things. We want to be able to say that we were able to create and build and do these things. And so a lot of the times you're able to be that best version of yourself when you have more energy, when you're moving around, when you've got that vitality, that let's call it that edge back when we
Yes.
thought we were invincible in our 20s and 30s, but carrying that energy level, but with the wisdom of what we've carried in our 40s and 50s is sort of like the goal that I set for people.
Absolutely
Because
right.
you're 40 and 50, you're much wiser as a human than you
Yes.
were when you were vitally in the body. So we can kind of move ourselves down that path. So I love that you've kind of, because it's really easy to understand in a short period of time the process you take and then layering that expectation, which I think is super critical for people's success.
Yeah. I think if people have that expectation, they know the program, where they're going to go, they understand it's not it's not just a quick 6 month program. It's not a quick fix. It's a journey, as you say. It's ongoing. And it's creating something which is easy, which is simple for them to do, and nothing massive. We're not asking them to lose huge amounts of weight. All we're doing is protecting the cardiovascular system, improving the vessels, making sure that the lining of the vessels are clear of cholesterol and cholesterol plaques. And how exercise can improve that, how just changing the diet, a Mediterranean diet. Because as you know, sugar is toxic, it's corrosive to your body. And it's, each time you're eating the wrong food, you're damaging that endothelial lining of your arteries. And your arteries are not going to thank you for it. Because heart, inflammation is painless. Chronic inflammation, you don't realize until something happens, until you suddenly get a stroke or you get a heart attack, because it's happening all the time. It's the little things you do, just looking at the types of food you eat, just changing a few things in your diet, using more olive oil, for example, using more omega-3 in your diet. Things like this will all help to improve vascular endothelium.
Yes, and I've been a big proponent of testing omega-3 indexing, and we've
Mhm.
interviewed the founder of that test on the show and telling people it's not just good nutrition. Like you
No.
said, if we can get that omega-3 and those omega-9s with the like
Yes.
olive oils and the
Olive oil,
avocado oils and start lowering the
olive
seed
oil, yeah.
oils, the it, the sudden death risk of cardiovascular disease almost disappears.
It's beers, yeah.
And no
Absolutely.
drug. I did my own podcast on this recently because I really wanted to correlate vitamin D, omega-3, and magnesium together, not separately.
Amazing.
How
Yeah.
they all, those three simple nutrients, which are robbed from our diets, our
Yes.
standard American for sure,
Okay.
and our modern day world. And so these are things that we need to add to the equation to get people to what you were saying, vital, healthy. I love that you said like the low level chronic inflammation is silent. People don't
Mm.
feel it.
No
They
feeling.
might, but they usually don't because
It's
that's the correlation is like the backward side of that is we know that 50% of people that have cardiovascular disease, their first symptom is sudden death.
absolutely.
50%,
Mm.
half of people don't know they have it before they die from it, which is
Absolutely.
where I think you're going with this conversation is we don't need to wait until the end to get where we need to go. And that's a really difficult thing, especially for men. So I'm going to ask you this question. What role have you seen that identifies and does identity and masculinity play in avoiding these things? Right? Because most men are avoiders. They don't want to admit, like you said, it's beyond ED, whether they're sick or they don't have health. And I know that when we can come to the table, but what do you think is that identity masculinity? What plays in that role when what you've seen when you get to uncover with people? What have they expressed to you?
The society we live in. See, when men are with when men are with other men and they go out for a drink or go to a football match, and all in that masculine environment, and no one will admit to you. A lot of my friends I know, no one will admit, "Oh, I've got an illness. I've got a problem." They don't talk about it. It's seen as a weakness because you're that group of male friends, all shouting and screaming and bravado, have that macho effect. I'm better than this or I'm better than that. And people don't want to admit, yes, and they look at it as a weakness. They think it's a weakness to go to your doctor. It's a weakness to talk to your wife or your partner about a problem. But it's not a weakness. It's actually being more brave and more honest with yourself that you've got an issue. And you've got to be more honest. And if you don't have that integrity about your health, then there's no point because you lose that effect of living longer and having a healthier life and having, leaving a legacy for your children. Because if you lose that effect, then you've lost everything.
And I think that's the piece that like, how do you, what's your idea on shifting that narrative?
I think it needs more awareness.
Mm.
People out there need to be more aware. I mean, if you take mental health a few years ago, nobody talked about mental health purely because they thought it was a stigma, it was taboo to talk about mental health. But once people in the celebrity world or people higher up, people started to discuss mental health, that more and more people became open about it and started to talk about mental health. Similarly, with men's health, there's a lot of talk about women's health, but not much talk about men's health. Nobody talks, a great deal about erectile dysfunction leading to heart attacks and what's causing erectile dysfunction. Many men have the problem, but are too afraid to discuss it. So all it needs is to have an open mind. Don't be afraid, and really go and talk to your partner, discuss it openly, and you feel that a big weight comes off your shoulder, and psychologically you feel a lot better. And so sometimes really mild psychological symptoms can then create a huge issue, and this can present itself physically.
I love that you're bringing it to light, right? Because yes, awareness, I believe, is the first step. Having
Mhm.
conversations, getting it more open, um,
Absolutely.
and I think there's nothing wrong with like talking about women's health, right?
Yeah.
And there's a lot more awareness needed there too, like menopause, and
Yeah.
it's not just a mental hot
Mhm.
flash thing. But
Yeah.
I also want to say, because that's why I feel called is to step up as well, is I believe men's vitality and health, especially in the ages we're talking about here, those men in
Yes.
40s and their 50s
It
going into
is.
their 60s, it's sort of not being talked about. Like men deserve that. And that's why I've been leading and participating in men's circles or men's work for over 15 years, because I've seen so many men be able to open up in a small circle of men to talk about the things
Yes.
that are affecting their vitality. And it's usually and all the people I work with and the people that I'm associated with, it starts with their business or who they are, right? Because that's what we identify as. But then it
Yeah.
works into being a dad, being a
Yeah.
family man, being a partner, and then we slowly get to them, like the part that men and women do is like, well, what about you? Like your vitality, who you are. Are you are you fully authentic? Are you living your best life? Are you
Mhm.
joyous? Are you happy? And so I think it for me, it is awareness. And then the other piece is community for sure. When men
Absolutely.
can talk about their things openly and being vulnerable or talking about them brings that to light again, because then men can hear like it's okay that I'm talking about it, but it helped me too, and so there's this. And of course, we should always be able to talk to our partners and our spouses, because
We
they're there
must.
to be supportive of us, right? So love that
Absolutely.
we're bringing this to a more open area, but also not designed just, oh, what's wrong with my body? How do I
Mm.
fix it? Right? Because
Mhm.
all of that if you're
Makes
not
sense.
open, you can't say it. Well, nothing will happen. And yes, men are traditionally, culturally avoiders of these things.
Absolutely. I mean, the famous thing, "Oh, I'm fine. There's nothing wrong with me." There is something wrong. You've got to admit that. And it's getting over that culture, that barrier to say, "Oh, I'm fine," or, that
Or
doesn't.
I'll be fine, right? Like, what does that mean? Like, I'll be
Yeah, no,
fine. That
no.
means you're not fine.
Fine. Not fine.
Well, I don't know about you. I've changed some of those. Sometimes words matter a lot. We
Yes.
talked about NLP and other things in
Yes.
this realm, but like I always say, how are you doing? And the deflection answer is always I'm fine, right? And I say, well, how you doing? And then I go, how you really doing?
Yeah, absolutely.
And
Are
I,
you
I
really
put emphasis there, because then most people get through that layer and go, well, you know what? That was my deflection answer, but really, I'm not sleeping well, or I don't feel like myself. And then we have conversation.
yeah. I see so many, patients, at the moment with say, "Oh, I've got no energy. No energy at all. And I feel fine, but I've no energy." But what's really the problem? You know, the real problem is something else. It's not just energy, and blood tests may be normal, but are they really normal? Are we really looking at the critical figures to see exactly what's going on in your bloodstream and measuring the right parameters like your real cardiovascular risk, like your ApoB and your LP little a? Well, we're just measuring total cholesterol, but we're missing out the important lipoproteins like LPA and so forth. So that's what happens. And people think, oh, well, my cholesterol's fine, but it's not.
Well, that's a whole nother
Yeah.
conversation. We have had the founder of a very simple cardiovascular inflammation test, and we talked about LP little a. We talked about homocysteine and
Yeah.
CRP and um and looking at these simple factors, right? These are not complex and they are not expensive yet. In the UK, in the United States, the standard of care is looking at a cholesterol number. Still,
Yeah.
when we
No,
could look at simple markers that would give us massive insights, right? So I'm glad that you are looking at this in the same light, looking at gut health, looking at cardiovascular health, looking at inflammatory health, looking at metabolic health, because it it all works together.
all works
We're
together.
looking at a men, right? Men's vitality. We're not looking at erectile dysfunction. We're not looking at lean muscle mass. Like we're looking at everything because
Everything.
everything is whole, right? Holistic health is integrative and getting to that ologist approach where we're looking at one little factor from an overall vitality perspective. So I love that we're going more broad spectrum and full circle
Because
because
it helps.
that is health.
Yeah. So I totally agree with you. We're too blinkered at times. We're very blinkered. We're just looking, focusing. You come in with a problem, I'm going to fix your problem, and away you go. That's not medicine. Medicine is really looking at this whole holistic type of approach and looking at all the causative factors rather than just saying, well, you've got something, here's a prescription. Your prescription pad should be put away and locked up. It's not just, you don't take a pill. You don't need a pill. You need to look at your body and understand what your body needs and how you can improve your health by simple things, just simple things.
Well, that is a big emphasis on conversation of how do we change health care, right? Instead of taking away a disease or a symptom of a problem, I love to tell people we're restoring balance. What you said is, what do you need? Not what do we take away?
Mhm.
And if we're restoring balance, then the body knows how to heal, period. And healing means vitality. If you're on all cylinders and you got good octane in your fuel in your engine, then ever and we talked a lot about the mechanism behind endothelial dysfunction. Well, what's endothelial function if we're restoring it back to good health is that fluidity of all that information that's going in between the cells comes from endothelial function. So when we're functioning better, we're restoring these things and we're telling people you can do this through diet, lifestyle, which is exercise and movement. We talked a lot about the importance of that. We are sitting beings more often than not now. So we do have to get up, put on a phone, and just you can get your 30 minutes in multiple places in a day. You could take 3 10-minute walks. It's still the same.
That's absolutely.
We've done studies to prove it's additive. It's not like, oh, I have to do a high intensity interval workout only.
No.
But the thing is if we don't move, we're in trouble. So let more movement, better food, looking at your nutrients in different ways to optimize instead of getting out of deficiency, and then looking at those factors for, like you said, metabolic health, endothelial dysfunction, inflammation, gut health. We know the correlation of the gut to everything else,
Absolutely.
heart
Yeah.
to mind, gut to mind, and
Mhm.
we're moving through that. I want to talk a little bit about technology in the future because you have this Vital-Health.ai.
Yeah.
And how does tracking the data change behavior?
Right. So what we've created is a platform which would be downloaded from the Apple Store at the end of May. At the moment, it's a web app. And what we're doing, we're monitoring your vital signs, like your temperature, your pulse, your blood pressure, your weight, your cholesterol, which you'll have to add into the actual program. But later on, even your sugar, your balance, which will be done by continuous glucose monitoring. A lot of these once the app is fully available, and by using wearables, a lot of this information can be tracked. Your pulse,
Yeah.
your heart rate variability. You got the Aura Ring, I can see. And these things will help you to monitor yourself. So by monitoring your health, that shows one, you're proactive. You want to get better. You want to live a longer life, and you want to live a healthier life. So once you get into the program and start monitoring yourself, you can see a difference by just doing simple steps. For example, if you start walking or you start improving your diet, you can then see your sugar levels falling. You don't get those spikes of high cortisol levels, which will put up your blood pressure. You measure your blood pressure once a week, which is a physical thing you've got to do, unfortunately. But there are new technologies on the horizon where you can measure your blood pressure through your iPhone by taking a picture of your retina. So that's coming out later on in the year, I believe. But lots of this technology and AI will help you to to improve your quality of life, because in the program we have AI to actually remind you of doing things in terms of taking a break, taking exercise, improving your sleep, monitoring your sleep pattern, so you get a good 7 to 8 hours of sleep. And also in terms if you're taking supplements, for example, like your vitamin D or anything to improve, or your magnesium, then it'll remind you to take them. And if you don't take them, it'll just remind you, well, you've forgotten. You should now take your supplements. So that's basis of how it's going to work.
I love it. I firmly believe not just labs, but health tracking. What you track and measure improves, period. If you don't see it, you end up. So I don't check my aura scores all the time now because I've got my routines and I know my baseline. But I've been tracking my health, sleep, activity, and readiness scores. I love also Aura, and we're getting closer with other technologies now too. Is like you talked a lot about pulse, and things of that nature, but really looking at it from, I love seeing heart rate variability and seeing that that can improve with the things we do. So if we're monitoring our lifestyle, because that's what it really is, you can see, and you said CGMs too, is like, if we're doing continuous glucose monitoring, you see in real time the effects of
what's going
on with what you eat specifically, not so there's this biofeedback that we're getting from that to allow us to track, measure, and improve upon. It's very similar to like putting on your gym shoes. Like if you just put on your gym shoes, you're more active to going to the gym than if you didn't put on the shoes in the first place. So when you're tracking and measuring, we all have one of these things, guys. We have a cell phone. So let's use it to our advantage, not just for the dopamine death scroll we use for these days.
Because once you start tracking, it gives you that incentive. It's that incentive to say, well, I'm going to do this. I'm going to do that. I'm going to improve my health. So this is what the tracking does. And once you see an improvement, you want to get better. You start to shift the needle. You keep getting better.
Yeah.
And that gives you a sense of satisfaction internally.
Well, and I think I'm in some men's groups and circles where you see there's also the let's use men's evolution to its advantage. Men are competitive too, right? And so part of our men's vitality group that we've created, I have this idea and thought to like, let's create challenges within the group. Hey, who can get their best sleep this week? Who can get their best exercise? So there's this level of camaraderie, but also that kind of, some people are more competitive than others, and some people just want to track and measure. It's okay, but the fact is, what you're saying and what I'm hearing you say is we have access to things we didn't have before with technology, and that I'm utilizing these things for AI, not to solve my problems, but to give me accountability, to give me the insights that I need to do my own work, to empower somebody else to do what they're supposed to do.
See, one of the reasons we also created the platform was because in the UK, to get an appointment to see a GP is horrendous. And by the time you see a GP, 2 weeks have gone or 3 weeks have gone. Then you got to go for blood tests. Then there's another 3 weeks have gone. And it's so frustrating. You just lose that incentive. And then people fall by the wayside. And people often get missed because certain important conditions can get missed. So that's one of the ideas. You can start taking accountability yourself. You can arrange blood tests yourself through the app. You can do lots of things like that. And once you have the results, and if they're abnormal, alerts will be sent to your GP. Look, this is what's happened. Now I can take action. So the GP then has a responsibility to take action.
I love it. Where do you see men's health and longevity going in the next 5 to 10 years?
I think we're at the very beginning, and there's a long way to go. And we are really at the early part of the curve. And I can see it's going to become a huge, huge, in the next 5 to 10 years, it's going to grow rapidly because the modern men now are thinking about themselves more in terms of leaving a legacy. They've worked hard, especially executives. They've got the funds, they've got everything in place, but the health is now suffering. And there's no point having a good life, having a good bank balance, but you're suffering in your health. You can't enjoy your health. You can't enjoy your wealth. Because at the end of the day, your health is your wealth. And if you can't have that health, then your wealth is useless. So it's so important to serve. Men are now beginning to realize there's a lot more to just work. We need a good lifestyle balance. We need an emotional balance to be with your partners and your children and to see your grandchildren grow. So men are beginning to realize there's a lot more to it.
Well said, and well said, quoting the sage Virgil. Your wealth is your health is your wealth. It totally is. And also living vitally means living
Yes.
in purpose, living in passion, living in you said legacy is a big word for a lot of the men have circles with. They want generational longevity.
Mhm.
And I think you're right. I think we're right at that beginning of this new age where
Yeah.
we're not just going to live longer, we can live vitally, and we're getting closer. Like we're moving closer to getting more proactive. So we're wrapping up here, but at Beyond the Pills, we talk a lot about deprescribing unnecessary medications. And I like to have these conversations with folks like you because this is how we have the conversation around, well, what makes a medication unnecessary? So, in your practice and in your experience, Ha- give us a few stories about people that have been able to shift away from that symptom management and the pill for the ill approach to, like, for men listening right now, like, I want them to look forward to when they can do these things properly and in the right timing and fashion. What have you seen?
Well, Josh, I'm treating a gentleman at the moment in his 50s, basically, high high earning, good job, but he presented to me with a rise in his blood pressure. But he didn't realize that there was more to his blood pressure than because it hadn't been measured for a while. He didn't have time. His weight had increased. The belly fat had increased. His cholesterol was rising, and he had no blood tests done. So after a long discussion with him, we said to him, we did our baseline tests, and we did all the blood tests and showed the abnormalities, the rise in the LDL, the low HDL, the total cholesterol was up, the HbA1c was rising. And we showed to him by using simple measurements, simple things like waist circumference, not looking at BMI, but we're looking at the waist measurement and compared to your height. And that's a much more important figure. We looked at his blood pressure and looked at his pulse pressure, which was quite high. And we also looked at his sugars and his LPAs and ApoBs. And we started him on a simple program of exercising 30 minutes a day, reducing all the the saturated fats, having more polyphenols, olive oil, Mediterranean diet, more leafy green veg, broccoli, spinach, kale, more healthy nuts, avocados, and we are monitoring him at the moment, and we can see that his pressure is now coming down, his blood pressure has dropped, his cholesterol is falling, and he's a much healthier person. So simple measure, simple rather than taking tablets, rather than taking a statin, rather than taking a blood pressure pill with side effects of blood pressure pills like cough and weakness and tiredness, statins giving you nightmares and brain fog. So it's easy and simple things to do. And this is what's really given him a new lease of life.
That was going to be my next question. I think you already answered it, but the question is, where do you see traditional medicine falling short, and where does it still have a place? And what you said really resonated, because I think it's not just I think sometimes we tend to, hey, presented with blood pressure issues and waist circumference, like, and all those things, and we say, like, try the lifestyle and then take these medicines. But what I've seen over and over and over again is nobody does the lifestyle. They take the medicine, they don't get better. And then the doctor kind of goes down the path with this patient that just adds more medication, not medicine, but medication. And it's like, all those simple things aren't tracked or emphasized in the beginning. And I think our that's where I'm at, but I want to hear what you think. Where traditional medicine falling short?
I think traditional medicine is that people's expectations are wrong. When somebody goes to the doctor, they expect to walk out with a prescription.
Yeah.
And the doctor doesn't give the prescription, then they say, oh, well, he's a hopeless doctor. They come back with a negative effect. But what people need to understand these days is not taking a pill which will make you better. You're more likely to have side effects of that medication and cause more, and you're missing the essential cause of your problem. Because again, as I said earlier, it's just like putting a sticking plaster over a crack. That crack is going to get deeper and deeper. So what we need to create awareness among patients that pills are not the first thing. We should be now looking at more lifestyle medicine, more integrative medicine, see how we can improve things for this patient, and then using medicine finally as a support mechanism when we need it, rather than saying, let's start off with pills first. That's not your answer.
Well, I love where you brought that, because you could look at that from both angles, right? People go to the doctor, they have a problem, they expect a prescription.
Yeah.
And if they don't get that prescription, they think it's a failure. Mm-hmm. So the opposite of that is true as well. Not the opposite, but look at it from the physician's perspective, or the prescriber. Mm-hmm. Is they're pressured to give a prescription because they don't want a failure, and they want somebody to. So it's almost this backward-forward approach. Like,
absolutely.
Physicians, they're not, and this is underneath. They're not pressured physically, but like that's generally what the programming has been. Go to the doctor, get a prescription, go home, get the prescription. Symptoms, like, the whole system is backwards, I think, because all the physicians that I'm talking to now, and people, like, we're getting this space, like you said, is let's teach them lifestyle. Let's get in the conversation and be real about it and say, listen, you might be coming in here for a prescription, but I don't start there.
Yeah.
And this is why. And then you go into the conversation. So.
And really, we should be looking at this from a younger age. We should be looking at teaching this in schools, teaching this in university, teaching them at a young age, so that they grow up with this lifestyle medicine, rather than expecting a prescription for every little thing. That's where we should be starting. Education.
I agree. And I think it starts in the home, right? It starts with everyone, because what we're talking about with lifestyle medicine, yes, being guided and understanding the science of how it affects the physiology and the biology and the health and vitality of someone is important. So, but all lifestyle factors are cheap or no cost.
Absolutely free.
It's free to get up and walk outside and ground in the nature. It's free to go for a walk. It's free to have a good night's sleep, and that's what it's fun to see people smile from that, but it's literally true. And you said it too, but my definition is making it simple and easy. I also think that we need to make it lucrative. In other words, valuable for somebody. and
Mhm.
fun. Why not? Like, if you don't like walking, find another thing you like that you're going to move. It might be kayaking, it might be bicycling, it might be whatever. I
Movement.
don't love running, but I can ride my bike 100 miles and that's fun for me.
Yeah,
But
absolutely.
just walking and going for a hike in nature, like
Beautiful.
easy, simple and
Relaxing of the
easy. And it settles your nervous system. It gets your autonomic nervous system and it does all of that. So what's one, I'm going to do rapid fire. What's one thing you want every man to stop doing? And what's one thing you want them to start doing today?
I want every man to stop thinking it's a weakness to admit a fault. I want every man to start walking, movement. And that's what and look at as a challenge for them. Every man to start walking 30 minutes a day will reduce your cardiovascular risk by 20 to 30%.
I love it. If a man listening today, right now, successful on the outside, but struggling in the inside, what's the first step he should take?
He should talk to his partner. Be open, be transparent. He's got problems inside he's concerned about. Sit down, be transparent, and say, look, I have an issue. Let's talk about it. Let's see how you can help me. That's what you need to say.
I love it. It's so simple. Where can people learn more about your work and connect with you?
Well, I have a program called ManStrong 2, www.manstrong2.com, where they can connect with me. I'll be happy to have a chat with them. No obligation.
Beautiful. Yes, and we will post all of your resources in our community site so everybody knows, and moving people down the community so they can get actionable items like talking to somebody, seeing if it's a good fit. We love partnering with strategic partners that are in the same line of awareness and just thought process with us. So our community app is Go Beyond the Pills and gobeyondthepills.com. You can get a link to this episode. You can listen to it at any channel you like, but what I want people to know is they can now link the episode to conversations we've had to give them the resources. So we'll get together on the back end. We'll get the resources for people to go through and moving that forward. So
thank you, Josh.
Suren, thank you for coming.
Thank you for inviting me. It's been a real pleasure. Lovely chat.
Happy to come visit you on the other side of the pond at some point. But for men, this one matters, guys. Your health is not a side project. It's the foundation for everything else in your life.
Thank you.
So, if this episode resonated, please share it with someone who needs to hear it, because that conversation that we both talked about around men's health is just getting started.
Thank you.
That's a wrap, guys. Until next time, stay well. Thanks for joining me today on Beyond the Pills. If our mission to de-prescribe 10 million unnecessary medications resonates with you, share this episode, subscribe, and leave a review. Whether you're a practitioner or someone ready to reclaim your health, visit rx2wellness.com for free resources to begin your journey. Together, let's go beyond the pills and co-create a world of vibrant health and true healing. Until next time, live better and stay well.